Hey, Dr. C with you. Let's talk about understanding levothyroxine. And this is important. If you've been told you need to take levothyroxine, you got to know what's going on. It's critical to really understand what's happening with your health, what your diagnosis was, why you were given the medication, what it's supposed to do, how much are normal amounts. Those are all things you'll learn in this video. For starters, let's talk about the role of levothyroxine, what it is and what its relevance is. So this is a synthetic form of an active thyroid hormone. Your thyroid makes two main hormones, T4 and T3. They're both active, they both do important things in your body, and your system can convert one to the other generally as needed. There are other active hormones as well. T2 is the most common one there, and this is used for hypothyroidism. Now, hypothyroidism can occur by degrees, and some degrees are far enough along to where the body cannot make enough by itself. And it's appropriate then to have some from the outside to help with that. I won't go into great depth on this, but most degrees of hypothyroidism are real and they can cause symptoms, but don't really benefit from medication. That's a surprising message, but it's very true. Diet and lifestyle can make a big difference for mild and moderate hypothyroidism. That's why I wrote the Thyroid Reset Diet book. It's based on clinical trials showing that diet can reverse it for most people. So levothyroxine-related medications would be Synthroid, Levoxyl, Tirosint, or Unithroid. Those are the most directly related ones. These are all T4 medications. So T refers to a protein called thyroglobulin. 4 is the number of iodine atoms attached to it. It's that simple. And then 3 is just one fewer iodine atom. So what happens is the body makes these hormones by packing iodine onto thyroglobulin. They're then released and they're then used and broken down by removing iodine. So that's the whole cycle. So T4 medications, those are some big ones. Other categories of thyroid medication, there's natural desiccated thyroid, which is porcine or pig thyroid. That includes Armour, Adthysa, and MP thyroid. Then there's compounded thyroid medication, which can be any of those ones that I mentioned, but they're made by hand in a compounding pharmacy rather than mass produced. And finally, there's over-the-counter thyroid glandulars. These are from cow thyroid tissue generally, and short thing, just not recommended. They do have active hormone, but they're not consistent. There actually are some over-the-counter that have pig thyroid, but still there's no standardizing going on. So the important thing though is just first off, if you need levothyroxine, that's the first question, you'd want to know that you had overt hypothyroidism. Ask your doctor about that. If you were said to have subclinical hypothyroidism, suboptimal thyroid levels, Hashimoto's, none of those things consistently benefit from medications. And it's a risk to take medication if they're not needed. But if you had overt hypothyroidism or your thyroid was taken out, totally appropriate. So what are dosing guidelines? Well, the starting amount for someone whose thyroid has been removed or is really shut down is about 0.8 of a microgram per pound of body weight. And so a microgram is the same thing as 1,000th of a milligram, which is 1,000th of a gram. So a microgram is a millionth of a gram. And the medication, it'll label that in terms of micrograms or in terms of grams. So a bottle might say 0.05 mg, that's the same as 50 micrograms. I'll use the microgram term because it's just more common. Now, there are differences. So that 0.8, it's a good idea, but it's not the law. It's not exactly how much you would need, but it's a pretty good approximation. The biggest differences are per your age, per your gender, whether you're on hormone replacement or not. But a simple example, so 0.8, if a woman weighed about 150 pounds, so 1/10 of that would be 15, right? So then 2/10 of that would be 30. So if we subtract 2/10, we get 0.8, and that's going to be about 120. So 125 in terms of pre-made dosages would be a likely dose she would need if her thyroid was to be taken out. But here's the thing, I want you to think through this common dosage range because some people are on amounts that just aren't close to that. The first thing to think through is what if your dose is a lot higher? Well, that's pretty much always a worrisome thing. And if your dose is much higher and your TSH is below range, you're simply on too much medication, and that's unsafe. There are some rare cases to where a good doctor may do that deliberately, but it's a concern, so there's that. What if your dose is a lot lower? If your dose is much lower than that, like let's say it's half or a third or a quarter of what you would expect you need, and your blood levels are stable, assuming you're not horribly underdosed, then that means your thyroid's part of the game. Your thyroid's making a lot as well. And good thing is you may not be dependent on medication long term. You may do fine to come off at some point in time. So yeah, it's good to be aware about those doses and think through how much you're taking and how much that really represents. Now, for this to work well, for levothyroxine to work well, the timing is super important. There's a lot of considerations to this. The medicine's taken most commonly once a day. Sometimes it's taken fewer times per week, but you wouldn't need to take it multiple times per day. And the big thought is that it's just hard to absorb. The amount of it is microscopic, and the proteins that comprise thyroid hormones are things that can get bound up by almost anything. Minerals or fibers or other proteins, they can make it not get in your bloodstream properly. And that's why your doctor and pharmacist should have asked you to take it on an empty stomach. First thing in the morning is most typical. Now, most people can do okay to take it an hour before their breakfast, their other pills or whatnot. I said most people, everyone is not most people. So some things that can be an issue can be supplements. Sometimes calcium or iron can be a problem. Coffee can be a big thing for some people. And in some cases like that, it might require separating the supplements or the coffee by 4 or more hours after your thyroid medication. That happens. There are also those who take antacids, and they can be appropriate, but they can make it harder to absorb the thyroid medication. One of the more common workarounds in cases like that is to move your dose from morning to bedtime. It's been studied quite a bit, and nearly everyone can do fine with bedtime dosing. It doesn't really wire you up or make you stimulated or make you not sleep because it's metabolized so slowly. So some things to think through is just about how these interactions could happen. You wouldn't want to have your supplements, your other medications, your foods with the thyroid. That's a big thing. Another big consideration is that there are times to where your needs will change. So if you're working on fertility, becoming pregnant, you're breastfeeding, your body's thyroid needs can differ. And in almost all cases, it helps to test more frequently and know about adjustments that come up. A big thing you might not think about is that there's brand names, like levothyroxine's a brand name, but there's also generics. And generally, your doctor will write your prescription to dispense as written, which means give this brand, or they might write substitution permissible. And that means the pharmacist could give a different brand or a generic if they thought it was more cost effective for you. Now, in some cases, even if a doctor writes dispense as written, you may get a different brand. I've had this happen to my patients before. And sometimes that different brand may not work the same way in your body, and that can cause your levels to become erratic. If ever there's a time in which you're on your medicine, you're feeling fine, everything is good, but then after one of the times you refill, something is off. Maybe you don't feel right. Maybe you're having the fatigue or the weight gain. Maybe even your labs have changed. That might be a sign that your medication has been switched. So it's good to know what your pill looks like. And online you can find out per the potency, per your brand, exactly the color, the size, the shape, any markings on that tablet. Be aware of those and get in the habit whenever you fill the prescription to double check and make sure you still got the same thing. Another point to know about is just checking in, being sure to check your scores regularly. If you're someone to where you're stable, all is good, you're never really up or down, some can do fine checking once per year. Most do better twice yearly. And if you've changed a lot, like you've had to adjust a dose or if it's been unstable, you might need to check more often than that. And that certainly happens too. One thing to be aware of is that when you are checking, there's ways in which you can make your labs more or less accurate based upon how they're timed. There's 5 rules here, and people often don't hear about them, but they're super important. The first one is you want to test before taking your medication. So you wake up in the morning, drive down to the draw station, get your blood drawn, then you take your pill. Most mornings you would probably take your pill earlier than that, but not the day of your blood test. You want to get your blood drawn before you have your pill. Now, the morning of your blood draw, you also want to be fasting. So water's okay, but nothing else, no food, nothing besides water. As far as things you're taking, you also want a 3-day holiday in which you've not taken vitamins. So no vitamins for 3 days before your labs are done. That's an important guideline. Next up is going to be the time of day. So I did say morning, so yeah, like 7 to 9 a.m. There is a rhythm to your thyroid hormones, and later in the day it won't give you the same results. And then last thing is being aware of your menstrual cycles. So your period and how it changes your hormones can also change your thyroid levels. If you're measuring your labs at one part of your cycle once and another part of your cycle at a different time, you may not really get the same results. The most accurate times are the first 9 days or the last 9 days of your menstrual cycle, so not the middle of your cycle. If your periods are erratic, just test while you're on your period. You know when that is. That's a little more objective. Now, if you're menopausal, if you're someone who's not having menstrual cycles, this doesn't apply to you. But if you are menstruating, this makes a big difference. A few more thoughts. If you're on medicine, things are stable, and you're not feeling well, the question is, what's happening then? And that's where you think through about any kinds of troubleshooting. You may be someone to where the medication wasn't needed to begin with. And in those cases, there is no right amount. Any amount, regardless of the dose and the blood levels, may not feel well for you. Generally, the medications are needed for those who lack a thyroid or who had overt hypothyroidism. If you had subclinical mild hypothyroidism, Hashimoto's only, anything besides that didn't include a full shutdown of your thyroid, you may not be well on the medicine because your body's not simply accepting them. Your body may be rejecting them. Other thoughts are you may be getting too much iodine. So there's a narrow range of iodine that your body needs, and there's a fair amount in the medication. So once you're on thyroid medication, it's easy to get too much from other sources and make the medication not work well. One more thought about troubleshooting is what we call the comorbidities. There's a lot of things that go along with thyroid disease. If you're prone to thyroid disease, you've got a really high chance of being below ideal in iron, of having something like atrophic gastritis, a stomach autoimmune disease. It's common to have fatty liver or to have an abnormal adrenal rhythm. But a lot of people are on medicine, they're trying to feel better, but they're not. They adjust their medicine, they change their medicine, nothing works. It's because there's some hidden comorbidity, so please be aware of that. So that's understanding levothyroxine and just having a better sense of how your treatment works. Hope that's useful. Dr. C with you, and I'll talk to you real soon. Bye-bye.